What is CYGNET and how are you involved?
The CYGNET study is an epidemiologic study. And so basically what the tools of epidemiology allow us to do is it allows us to look at important sort of health-related questions in human populations. For example, our CYGNET study girls, actually becoming young women now, not so much girls anymore, and really studying people in their natural environment. So the CYGNET study is a study basically looking at why some girls mature sexually earlier than other girls. And so that's really what it's about. And we're looking at a broad constellation of factors. We're looking at environmental factors, that's sort of the main focus, but we're looking at nutrition and physical activity and psychosocial factors and sort of larger societal factors. And my role in this study is I'm the principal investigator. And what that means is basically I'm overall responsible for running the study and the financial aspects of it and making certain things happen and that type of thing.
What components of the data collected in CYGNET do you use for your research?
So my primary interest has been on nutrition and physical activity and sort of lifestyle choices that people engage in. And so my primary interest is in looking at these dietary factors and physical activity patterns and obesity and that type of thing. I should say that another great thing about the CYGNET study is that it's really an interdisciplinary sort of research program. All the researchers really complement each other, not just within our study, but as you know, we're also a partnership with studies in Cincinnati and in New York. So looking at people who are kind of like my counterparts in those studies. The study in New York is run by someone who's really an environmental scientist. Her name is Mary Wolf, sort of a toxicology and environmental factors background. My background is really in nutrition and epidemiology, and the person who leads the study in Cincinnati, he's a pediatrician. And so the three of us complement each other, and then within the CYGNET study team, we have an adolescent health psychologist, a pediatrician whose specialty is on hormonal sort of factors in pediatrics. We have a physician epidemiologist. We have people who are involved in molecular epidemiology, so really looking at sort of DNA and molecular aspects. So we have a great sort of multidisciplinary team. Plus, we were working closely with the Zero Breast Cancer group, who helps to keep us, sort of relevant to the world. And then we're working closely with all of you, as study participants. So it's like this great sort of multiple perspectives, that really helps to inform what we're doing and how we're doing it. And so my sort of close to my heart interest is the nutrition and physical activity piece.
Obesity rates have almost tripled among youth over the past 30 years, with 1 in 3 children in the U.S. considered overweight or obese.
Regular physical activity should amount to about an hour a day for children ages 6 to 17.
Studies have shown that a girl who is obese is more likely to begin puberty at an earlier age.
Healthy eating should emphasize fruits, vegetables, whole grains, and choose foods that are low in animal fats, salts, and added sugar.
Eating healthy and being active can help maintain a healthy weight and body fat level and may help reduce the risk of breast cancer later in life.